orthodontics for over 25 years. And why is it that a lot of the cases work, but there's some cases that didn't work? And I finally found out from my mentors, Dr. Mariano Raccaballo and Dr. Jay Gerber, that this is one big issue right here, the forward-head posture. And this is why, knowing what we know now, we could actually improve even cases or situations like Ryan.
This is Dr. Roland Estrabillo. He's a holistic dentist who's owned his own practice for over 30 years. When I visited him when I was 16, he recognized the effect poor tongue posture and mouth breathing had on my facial growth. Fast forward 7 years, and Roland has transformed the way he treats his patients. He looks to improve their tongue posture, airway, and body posture. He's received training from experienced physiotherapists and myofunctional therapists and integrated it into his own practice. This series is going to be giving you guys an inside look at how he treats patients with poor posture, me being used as an example. I'm going to document my progress with him every step of the way. I am Ryan Blankers, and this is my mewing transformation.
I'm excited. It's very exciting because you know what? This is the beginning of something really big that will enable us actually to potentially improve the quality of lives of people.
Yeah.
And you are the good case study because you actually went through the process.
Yeah.
Okay. I did orthodontic on you. Remember?
Yeah.
And
so Roland. We expanded my palate when we originally found that I had these issues, that I used to be a mouth breather. My face developed into this long, narrow shape. And Roland actually identified this about 6-7 years ago when I was 14, 15 years old. And definitely most orthodontists would have completely missed that. So at that time we expanded my palate, then we put braces on because I had a big gap in between my teeth from the rapid maxillary expansion.
Which is right there. We actually did that.
So we fast forward to now, and Roland's saying, okay, this is how I treat my patients now. He takes them through a very thorough assessment where he uses photos, he uses scans of their spine and various things which we're about to show you, and he did the exact assessment on me. So this is my starting point. This is my baseline. This is where I'm at right now, and we're going to show you guys how Roland assesses that and how he assesses your current posture of your tongue, your bite, your cervical spine, and various things. And we're going to show you guys exactly how he does that. So then, I'm guessing later on in the treatment, we can reassess it and see the results. Is that correct?
The improvement, of course.
Yeah.
You have to have a baseline. Because if you don't know where you started, guess what? How do you know that you're improving or not improving? So we're going to go through what we went through with Ryan right here. Very first and important thing to note is the photographs. You could take your own photographs. As you can see from this image right here, we use just a camera from a telephone. You see, we take these photographs, and from these photographs we can see already the asymmetries that Ryan's got. And also, you can see on the arrow right here that I pointed out, his left sternocleidomastoid, which is the muscle right here, is more pronounced. Why is that? That's actually contributing to the tilting of the head and even the scalene muscles right here on his neck.
So so the first part of the assessment Roland did is literally just taking photos from the side, from the front, and looking at the photos and assessing the posture on a very basic surface level, right?
Exactly.
So that's the beginning. So what did you see from my picture?
Okay, so here are the series of photographs that we took from the frontal shot that we took just with the plane camera, and you could do it yourself. You will notice that Ryan's left eye is higher than the right eye. Okay, left ear is the same thing. Now you can see the shoulder right here. The right shoulder is higher than the left shoulder. So it's actually, I'm going to exaggerate a little bit. He's actually like this.
Yeah.
Okay? That tells me already that there's an imbalance in these muscles. in his neck muscles, or even the back muscles, the trapezius. Now Ryan is working out, right? If he's not working out, he's probably gonna have even more issues.
Yeah.
Okay, so that's just with the frontal shots. And then I look at what? The big, all like top to bottom shot of Ryan, just to what I want to see if there's even bigger issue with his stance, right? And now look at the side shot right here. It's very obvious that from this picture that his shoulder is behind his left his ears. That tells me already that he's got a forward head posture. Now we're going to talk about forward head posture later on. But automatically, because he's got a forward head posture, if you are leaning forward, automatically you have to what? You have to turn your head up, rotate your head up to what? So you can see where you're going. So you don't hit anything, right?
Yeah.
And that has a big impact on the rest of his breathing as well. As well as the jaw angle, all of those. We're going to talk about that. So there's a head rotation just because of the forward head posture now. Now, the airway is already getting compromised when somebody's got a forward head posture. You can see right here with that side shot again, the ear actually, normally they're up and down, they're not tipped backwards. The fact that Ryan's ear is pointing backwards, that tells me that's a proof that's already, he's got the head rotation backwards like this. And I'll tell you later on why that is significant. And also, his profile right now is convex, so he's actually bulging in front right here.
Yeah, so I want to quickly to talk about that. I mean, this is the thing that most people see with mewing, or if you want to improve your tongue posture, is that you have the recessed chin, the middle of your nose is sticking out, and your maxilla is actually further down than it should be because the tongue is not exerting the proper force. So this is why my face has changed, because this is what a lot of people care about. A lot of people care about the shape of their face.
Okay.
Right? So how has this, my posture, impacted this shape of my face, and why has this happened?
Well, it's automatic because his forward head posture. Because of his forward head posture, he's not able to breathe properly. Guess what? He has to extend his head this way, tilt it backward. And by tilting it backward, he also tilts his maxilla backward. And by tilting the maxilla backward, what that means is his back teeth are going to touch more, right? So the teeth at the back are touching. And by that, his jaw is going to open up. Guess what? As you open up that jaw, guess what's going to happen? He's got insufficiency on his lip. He's going to have lips that are not going to... How are your lips? They're not meeting.
They don't close properly, yeah.
If you don't exercise them.
Right.
And that's a part of the forward head posture with the head rotation.
Yeah. Okay, got you. So let's keep going here.
Okay?
So that's the photos. Okay.
That's the photos. From the photo, that's what we got. So now we have a few other things that we need to see. Now we have to confirm that from the Cephalo Metrics. There are two kinds of Cephalo Metrics. From the side, which is lateral Cephalo Metrics, and from the front, which is the anteroposterior Cephalo Metrics.
So cephalometric is basically like a scan.
It's a diagnostic X-ray.
It's an X-ray, so where you can see the actual bone of your face and your skull to see the angles and how your bone has grown. So we're gonna see some really interesting things here about mine. So we'll start with the Mcgregor Plane, right? That's the first photo. So tell them what that is and why mine is larger than it should be.
Okay, so this is the Mcgregor Plane. The Mcgregor Plane actually is the plane of the palatal plane connected to the cervical lowest portion of the occipital bone. So if you draw a line from the palatal plane and the lowest border of the occipital bone, that is called the Mcgregor Plane. Now the C2, the tip of the C2 here and the tip of the dens, if you actually draw a line, the intersection of the Mcgregor Plane and the C2, that's very important. On somebody that has a good posture, that is 101 degree. Very important number. With Ryan, what is your number?
92.
It's 92 degrees. very acute. So that means his head is rotated so that that angle is actually smaller. From 101 to 92.
So my head is rotated like this. That's what that angle says.
Exactly.
Yeah.
Okay. Now that is a compensatory mechanism because what? He's got a forward head posture. His head has to rotate, or else he will always be bumping on somebody if he stays that way, right?
Okay. So next is the SNA and SNB.
So the SNA, this is the cella, which is in normal orthodontics, we have the pituitary gland is nestled in the cranium, and there is this concavity right here. That's where it's sitting. If you draw a line from that center of the pituitary gland to the nasal, which is the deepest portion of the nasal area right here, it's called nasal. And then the maxilla is SNA, that's the A point, and the mandible is a B point. So SNA, SNB. Those are the traditional angles that we look for in orthodontics. What are your numbers? What are your values? 85 degrees. The normal is 82 degrees for SNA. And for SNB, the normal value is 80 degrees. What is your value? It's somewhere there. So bottom line, because Ryan has got pronounced maxilla, it's going to be bigger. Okay? So what happens is, if we actually rotate the head back, the SNA is going to get smaller and the SNB is going to get smaller. Guess what? His jaw being angled steep like this is going to go up.
Correct, yeah.
So now he's going to look he's good looking as a young man already. He's going to look even better.
Okay. So the next one is the angle of the jaw.
That is because of the angle of the jaw. He's actually forced to open his jaw because his upper teeth and the back teeth are healing because of the rotation of the head. Okay?
Yeah.
It's automatic. Now guess what? Because of that, your airway is getting even more compromised. So now you're going to breathe more through your mouth now than your nose.
this my angle here is 133 degrees, and the normal for males is 119 plus minus 6.5. So the highest it should be is 125, mine is 133. So obviously the angle's quite a bit larger for my mandible, so my jaw is swinging downwards. That's something you see commonly in people with poor posture, tongue posture, is that not attractive. People imagine someone with a good jawline that's good looking. People imagine a very square jaw, right?
Right.
So that's what we're after. That's what we're trying to improve with.
And it could be possible. You could improve that angle. That's improving your breathing. That improves
Everything.
your looks.
It's health and looks, right?
Right. It's
Right.
actually very healthy if you breathe properly. And here is from the same lateral cephalo metrics, you can see Ryan's cervical vertebrae are actually a little bit more curved forward rather than the conventional lordosis, which is curvature at the back. His are actually straight and curved forward.
Yeah. So that's part of what we need to improve is the shape of the neck. Yeah.
The cervical vertebra. So again, in here it shows how, look at the profile of Ryan. It's actually, you see people with their forehead is like up this way.
Slanted back.
Slanted back, right? And the nose sticking up and then they go slanting back inside right here. Because the jaw is actually down, right?
Yeah.
That's the convex profile. Now, that's what we see with the lateral ceph. The other thing that we see with the lateral cephalo metrics is if you actually pick up a point on the most distal aspect of the mandible plus the lowest point of the C3, that line will determine whether the suprahyoid muscles are very active or infrahyoid muscles are very active or not active. Okay? With Ryan, because his hyoid bone is touching that line, that tells me that his suprahyoid muscles are very active. Well, guess what? If they're very active, again, that will actually pull all the tissue backwards again. And what is that going to do? With these tissues at the back going forward and the suprahyoid muscles going this way, that is going to impair the airway even more. It's all about breathing properly, my friends.
So that's what, actually, since he's shown me this and I've been stretching the suprahyoid muscles, I told him I've been breathing through my nose at night, which is, I haven't been doing that for years. So it's incredible. This is what I mean, is that I've been trying to improve things myself for the longest time and doing tons of research. And he showed me this one thing, which was that the suprahyoid muscles, obviously that's not the only problem.
Yeah.
There's a lot of things we're addressing, but just by me stretching, I feel like I have more room for my tongue and I can breathe better. It's amazing.